Good day, everyone. Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we will present to you a new machine that CSA has right now, and it's a management for the problems of acne scars or face scars. So we have with us right now Miss Sandra. Okay. So, hi to Sandra. Right. Okay. Now, yung concern na acne scars naman po, yung mga pinagmulan ng mga tigyawat, yung mga naging marks ng tigyawat, atin naman po ang i-treat or i-manage. Okay? So, we'll start with, for every patient, we do skin analysis, right? Yes, Jen. So, kailangan ina-assess muna po natin. Kasi, Jen, di ba, yung mga iba nating mga patients or clients, they would ask, ano pong treatment sa acne scar? Or magkano po ang treatment sa acne scars? Kailangan muna po naming mag-assess sa inyo. Kailangan i-check muna natin. Kasi marami pong klase ng acne scars or face scars. So, meron tayong tinatawag na types of acne scars. Andyan yung ice pick scars, box scars, rolling scars, undulating scars, yan, or pitted scars, or yung parang iba mga craters or crater-like. Yung iba naman, mga discoloration lang. Hindi naman sila sunken or depressed, meron lang silang mga blemishes. Parang nag-hyperpigmentation lang. It's like a hyperpigmented macule. So, ayan, meron palang classification ang mga acne scars. So, importante po na ang doktor ninyo ma-assess muna yung klase ng acne scar para makapag-recommend kami ano ba yung specific treatment dun sa type of acne scar na yon. Kasi iba yung sa ice pick, iba yung sa mga box scars, iba yung sa mga rolling scars. Yun po yung mga depressed acne scars. Yun yung mga sunken scars. Kasi marami yung mga concerns nila, ang lalalim ng mga pinag-iwanan na marks ng tigyawat. Si Jen kasi tinitignan ko, napaka-clear skin eh. Of course, marami sa atin po gustong maka-achieve ng pimple-free skin, scar-free skin, clear skin, flawless skin, even toned skin. Yan. So, sa Sandra din, right? So, of course, lahat tayo siguro deserving to have a beautiful face, a beautiful skin. Sabi nga namin, even yung mga patients na may mga skin diseases, of course, gusto rin nilang magka-beautiful skin. Pati yung mga acne-prone na skin or yung may mga tigyawat or yung may mga oily skin. Of course, we wanted to have a beautiful skin, a clear skin. So, kaya po pinag-uusapan natin dito, ano po ba yung mga tamang treatment for each type of acne scars. Okay, assessing Sandra right now. Actually, Sandra, you already had managements before.
Yes.
Nagkaroon na po siya ng session nung tinatawag naming RF microneedling or Infini. One session, right?
Yes, one session.
Yes. So, dati, yung mga sunken scars niya, mas malalalim pa. Tama po ba?
Yes, Doc.
And yung sa kanya kasi, meron sa cheek area, and then meron dito sa lower part of the face, meron din siya sa chin area. Tapos sa kanyang nose, parang mga open pores lang eh, large pores. And then sa temple, meron din po siyang mga sunken scars. Kasi marami yung mga iba mas malalalim sa temples eh. So, meron tayong case before, right?
Yes.
Na ang lalim ng temple acne scars niya. Hindi lang naman acne scarring, meron iba chickenpox scars or any types of scarring from like for example na aksidente or mga form of trauma or nagkaroon ng mga cuts or lacerations sa face. So, nag-iiwan din ng mga scars. Okay. So, si Sandra, nagkaroon na po kasi ng treatment before. So, ano yung treatment mo? Infini? Ano pa?
Lasem.
Nagkaroon na rin siya ng lasem. Yan. Oh, mga electronic machines na try na pala ni Ma'am Sandra. Okay. So, dito sa kanyang mid-face area, medyo nag-ibabaw na po eh. Na-notice ko dati kasi mas malalim. So, si Sandra kasi combination yung type of acne scars niya. May makikita kang ice pick, meron ka rin makikita mga box scars, meron din yung mga rolling scars or undulating scars. Yung undulating, pag in-stretch mong ganyan, parang medyo bumababaw eh. So, combination. And then, meron din po yung parang mga blemishes. Okay? Although Sandra still has some acne problems, kasi sa babae po, sabi ko nga, minsan because of menstruation, yan, kakaroon pa rin po kami ng pimple. Yung sa menstrual cycle natin. And then, dito sa side na to, actually, I'm noticing medyo nag-resurface na po siya. So, ang acne scars natin, the ones that we're treating is a combination type of acne scars. So, when we have that, combination therapy din po. So, ang ating remedy ngayon, we will do the so-called Infini or the RF microneedling. Okay, ipakita natin ang actual procedure sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So we will start with our procedure of RF microneedling. We have here our machine from Lutronic. It's called Infini. So I think some of our televiewers already have an idea of what Infini is. And we understand that it's a management for acne scarring. Actually, this is best for those individual na mapag-hyperpigmentation. Kasi the others, when they do CO2 fractional laser, we also have that. We have Pyrocell here. The other problem that they encounter is the PIH or post-inflammatory hyperpigmentation. So, tayong Asian skin, phototypes 3 and 4, we are prone to that pigment formation. Yung iba kasi pag nag-CO2 fractional laser, may nanonotice sila na nangingitim. So, the alternative for that will be Infini or RF microneedling. And then the others, ayaw nila ng mahabang downtime. Kasi with the CO2 fractional lasers, we know na merong redness after the procedure at saka yung mga laser marks, yung grids, yung parang may screen sa mukha. So, some of our patients say na parang 3 days bago mag-fall off, the others 4 days, 5 days, yung redness nila, yung mga iba, very slow healing, 1 week umaabot. So, if you want shorter yung downtime, the Infini will be best for you. So, right now, we'll do this procedure for Sandra. We have done one Infini for her 4 weeks ago or a month ago. So, ang interval nito, pwede tayong every 4 weeks for this one. Yung number of sessions, it will depend kasi gaano kalalim yung ating mga acne scars. So, Sandra would need few sessions na lang and then polishing na lang yung surface ng kanyang skin. So, we have here a technology from Lutronic. It's called Infini. It has this handpiece and actually, meron siyang mga microneedles. And these microneedles is specific for every person. So, ito po yung pinapalitan namin lagi. So, kailangan nating sterile. So, single use lang po ito. And then, we use this, as I've said, single use. Minsan na lang po namin gagamitin just for you. And then, the needles actually are insulated po. So, meron silang ini-emit na RF heat para magkaroon ng tinatawag na coagulation dun sa dermal layer of the skin for a better fibroblast stimulation or repair tissues. Yun po yung pag-induce ng collagen synthesis so that yung mga scars, yung mga lubog, mag-reform ng bagong connective tissue matrix, ma-fill in sila or mag-angat sila or mag-resurface sila. So, yun po yung basic mechanism or concept. So, meron siyang mga tiny needles or microneedles, marami-rami po ito. And then, it has a tiny puncture effect dun po sa ating inner layers ng skin. Iba-iba po yung depth. Minsan, meron po kaming 1.0 or less than that. Or 1.25, 1.5, merong 3 to 3.5. So right now, meron po siyang auto mode. Okay, the good thing with the machine, it's touch screen. So auto mode tayo, and then we just follow if what area we wanted to work on. Like for example, mid face to lower face, and then it tells us kung anong depth. So like right now, I have a 1.25 millimeter depth, and then in terms of the intensity. So this is an easy technique. Okay. So we press lang yung button na to for ready. So we wanted a 1.25 or 1.5. The last time you used 1.0, right?
Yes.
Okay. So actually, I think we can have 1.5. Kaya na, Sandra?
Okay, Doc.
Okay. Later on, we'll ask Sandra, ano ba yung sensation? Masakit po ba? We'll ask her. Okay? So we have a 1.5 po dito. We'll just follow this screen here. And then, parang pong stamping technique. So, I'll start sa kanyang mid-face. Okay. Now, just level on the skin and then press the button. Yan. Okay lang po. Although parang may gulat effect lang, but it's tolerable, right, Sandra?
Okay po, Doc. May anesthesia lang po.
Yeah, actually, before we do this, we had topical lidocaine naman po. Okay. So, I'm just gentle po. So, we can do this procedure. Pwede pong mabilisan. And target areas talaga are those with mga sunken acne scars. So, as much as possible, we target the problem area. So, some of my patients are asking kung may active pimple ba, is it okay? So, kung minimal lang naman, like 1 or 2 lang naman yung ating acne lesions or just few lesions, okay lang po. Then we just target yung mga may sunken scars. So you can do like 1 to 2 passes for every area. It's normal to expect also some redness here. Or sometimes may nakikita kang parang pinpoint bleeding from the tiny needles. Kasi before we were doing yung manual na derma roller, right? Naabutan mo yon, Jen?
Yes, Doc.
Yung mga microneedling, they call it collagen induction. So, I did this part. Okay, meron din siya for the periorbital region. I wanna touch the temple region. So, press lang po yon. Okay, so, ang kanyang level will be a 1.0. Okay, I'll just change into a 1.0. So, this is a very easy procedure for doctors. I recommend that, of course, mas maganda ang ating mga doktor ang gumagawa ng mga procedures. Safety first, ika nga. And mas mainam ang doktor dahil, of course, for a long time that we have studied, we know these kinds of problems and we know the management. Okay. And if we trained our estheticians or our assistants, they have our supervision also. Like Jen here, she's a laser specialist. So sometimes I have her perform my procedures. And most of our laser specialists and our therapy provider, of course certified po sila. So most of us here, we undergo trainings. So I did this part. So Jen can also do the left side. Okay. So Jen was holding an ice roller, so that's also to help in the relief of pain or to attenuate the pain. So kanina, we already had a so-called numbing of the skin, right, Sandra?
Yeah.
So nag-iwan kami ng topical lidocaine. We left it for about 45 minutes, or you can even leave it like an hour just to numb the skin. And if you notice, there's erythema. This is a transient erythema or temporary redness. And parang a little bit, nag-swell ng konti yung skin. But this is very temporary. Because after the Infini, we will proceed with the so-called Healite therapy. The Healite is a machine to give a quick recovery, to relieve the redness instantly. I really say instantly. Kasi when we did that before, during her first session, we immediately proceeded with the Healite therapy. And I think ilang minutes lang, Sandra, right?
Opo.
Nanonotice namin, sandali lang, the redness went away. So,
Mawawala
minutes
po agad.
lang, yeah. So, nawawala agad. So, for those people na ayaw lumabas ng clinic na pulang-pula, we combine it with the Healite. Okay. Okay, so while we're doing the actual procedure of the Infini, okay, Sandra, can I ask you a question?
Yes, Doc.
Yung first session mo with the Infini, okay, you noticed already an improvement?
Yes, Doc. Nagkaroon na po.
Yes, right.
Parang mga 1 week, 2 weeks lang po
Noticeable.
may napansin na po kung may umangat na po sa mga scar ko.
Yun. So, palagay mo, mga ilang percent ng improvement? 10%, 20%, 30%?
30%, Doc.
30%. Every time we do some acne scar therapy here, making use of our laser devices, I think I could say merong iba 20%, 30%. The others pa nga, they say 40%. And I think it has to do with the faster healing of the skin and of course, how young is the patient. The younger the patients, of course, mas mabilis yung kanilang collagen stimulation. Okay. And Sandra is in her early 40s. Tama, Sandra?
Opo.
Yes. So, she said 30% improvement, mga ka-CSA. Isang session pa lang yan ng Infini. So, probably this time, another 30%. So, you might need another 2 sessions. And then, okay na po siya. So, yung mga sunken scars had resurfaced already. It leveled up on the skin surface. And I think also improvement, collagen stimulation. It's anti-aging, right, Sandra?
Opo.
So, yung mga
Nakakatulong po.
may fine lines, wrinkles, mga nagsasagang skin, hindi lang sa acne scar, this will help because of that collagen stimulation. So, mga ka-CSA, we'll show you our next therapy for Sandra sa pagbabalik ng CSA Certified Skin Authority. And we're back, mga ka-CSA. So, we have done Infini for Sandra, indications, acne scars, and we had a total of about 300 counts. Kung ilang beses po natin in-stamp yung tip ng ating Infini. So again, yung pong ating mga tips na yan, they're individualized and single use only. Okay. So, we have done the Infini. Ang effect ngayon po, meron ng redness. Of course, we expect that for any procedure, like even the mga lasers, or itong post-RF microneedling, and other types of procedures, even yung sa mga chemical peeling, you'll see erythema or redness. So what is our remedy for an immediate relief of that redness? Yung mabilis pong mawawala yung pamumula. Especially tayo, napaka-busy natin. Ayaw rin natin yung may mga downtime na matagal ang pamumula or matagal yung mga marks from these procedures. So we have now the so-called Healite machine. So this kind of machine, ito'y LLLT also. So meron din siya yung low-level laser therapy or low-level light therapy or yung tinatawag na LED phototherapy. So may mga certain wavelengths din po yan. So ito po, so Sandra had the redness. So nakikita nyo po sa inyong screen na pulang-pula yung skin niya. Actually, we did several counts, 300 marami po yon. We really targeted yung whole face area. Siyempre, sinasamahan na natin ng anti-aging, anti-lines, anti-wrinkles, anti-sagginess. So actually po pala yung Infini natin, hindi lang naman for acne scarring, yung may mga concerns na yung mga old scars, atrophic scars. So yung mga deep lines, wrinkles, or periorbital lines and wrinkles, meron siyang pang periorbital rejuvenation also, or yung mga saggy areas ng face, sa mid-face na saggy, or yung mga jowls, or pwede rin siyang for neck rejuvenation. So that Infini can also be utilized in our anti-aging, not only for scars, also for women na may concern na stretch marks, mga post-pregnancy stretch marks, or even men na may concern na stretch marks, yung mga dati na overweight, and then they lost weight, and then nagkaroon din ng mga tinatawag na stretch marks. And other indications, we can make use of our Infini. In addition pala, yung mga severe sweating sa underarm, we can make use of Infini, or the others yung palm sweating or yung sweating sa paa. So sa kamay at sa paa, we can make use of our Infini for the treatment of hyperhidrosis. So ngayon, we'll do the heel light. So Jen will have yung screen natin also, ayan, push button or touch screen. Ayan. So ang ating mga machines po, they're touch screen. Very convenient, very user-friendly, easy to use. So our heel light, so it's indicated for wound healing, so post-laser procedures, post-Infini, post-RF microneedling, post-chemical peel, or those yung may mga chronic wounds or may mga ulcers, ulcer wounds, the cubitus ulcers, yung may mga bed, what do you call this? Mga prolonged na nakahiga po, yung mga bed sores. Meron silang study na ginawa na nakamanage din siya ng bed sores. So yan, wound healing. They will hasten yung improvement ng mga wounds. Okay? So, hasten scar improvement, pati yung mga post-burn patients or mga post-surgical, yung mga halimbawa, laceration and then your doctor sutured it. So, faster healing po. So, indicated din ng heel light yung sa mga post-surgical procedures or yung mga burn patients. Okay, wound healing process after surgery. And actually, they added pa po yung sa hair regrowth, yung low-level laser therapy, it can induce hair regrowth. So, for our clients po na ang problema din, baldness, hair falling, or yung mga thinning of hair, or yung mga female pattern of baldness or male pattern of baldness, we can make use of our heel light. So, ang dami po palang applications nito. Actually, nakikita nila namin sa mga rehab centers, they make use of this. Or yung mga centers for hair regrowth treatment, meron din po ang heel light. And CSA now has heel light sa aking mga patients who are doing mga laser procedures, chemical peeling, or yung mga nose lifting, non-surgical nose lifting, non-surgical face lifting, we can make use of this already. So, di ba, Jen, even yung mga nalalasem laser ko, yung mga namumula after the procedure. And I like this also, yung may mga active acne. So, Sandra has minimal lesions ng inflamed acne. May anti-acne, remedy po. So, ayan, dun sa mga patients na yung mapupula yung skin, mayroong rosacea, or yung prone sa acne, or what we call acne rosacea, we can make use of our heel light. They had a study presenting po yung therapy na using this one, if you don't want to have yung mga conventional anti-acne drugs, yung mga oral isotretinoin, if you don't like it because of the side effects, heel light is a remedy. So, yung inflammation ng acne, natatarget po nito. Kasi ang hallmark po ng acne problem is inflammation, aside from the other inflammatory processes po. Actually, this is relaxing eh. I love this heel light na actually po makakatulog po kayo where you're doing the heel light. I think Sandra is falling asleep already and she deserves to rest. So, kailangan din po nare-relax kayo while you have a therapy. So, I tried this, back pain, okay, it relieves your back pain. So, ito po yung mga safe regimen, safe therapy for mga ganong indications na wala po kayong worries for any adverse effects. So, immediately after the Infini, she had redness and then we followed it with the heel light. So, after the heel light, there's already a reduction in the redness. And maya't maya po, marireduce pa yung pamumula ng skin ni Sandra. So, kamusta po ang procedure, Sandra?
Okay naman po. May konting saglang pero kayang-kaya. May anesthesia naman po kasi daw.
Yes. Kasi nanam tayo kanina dun sa
po.
lidocaine cream. Nakatulong yon. So, tolerable po.
Kaya po.
Yeah. Nafe-feel mo lang yung parang
Tusok.
tiny pricks. Yeah. Pero, hindi naman yung talagang masakit. Tamang-tama lang. Kaya lang. Kasi hindi ka naman lumuha. Okay. So, yan. Redness lang po. Temporary, maya-maya, minutes, nagki-clear pa po yung kanyang pamumula. Okay, so we have done Infini and heel light in this episode. Kung meron po kayong katanungan, you may email me at csaskinclinic@yahoo.com. We have our CSA FB page, CSA Derm Centre. And I have my Instagram, doc_Contessa. Ang aming clinic ay matatagpuan dito sa second floor ng Pure Gold Dau Building, Dau MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0933-860-9193. Again, ang iba naming mga episodes nasa ating YouTube. Only type Contessa Salvador. Okay, thank you very much po sa inyong lahat. Thank you, Sandra.
Thank you, Doc.
Okay, abangan pa po natin yung improvement. Okay, 30% last time.
Yes, Doc.
Probably ngayon, 40% kasi 300
Yes.
Shots,
300
no?
shots more.
Yung last time, 150. So, we'll have a review sa ating mga coming episodes again. Okay? So, mga ka-CSA, when it comes to natural beauty, you can trust the CSA Certified Skin Authority.